Sepsis can affect anyone at any age, and to put it simply, sepsis is your body's toxic or severe response to an infection. A Sepsis Alliance survey says that only a little more than half of American adults have ever even heard of the word. The CDC says there are more than 1.7 million cases of sepsis every year, and survivors deal with long-term effects like amputations, anxiety, and chronic pain. And talking to us today from the North Suburban Medical Center is critical care physician Dr. Sam Ancheril. Thanks so much for joining us today.
Hi, thanks. Thank you for having me.
So let me ask, why is there so little awareness about sepsis, and what do people need to know?
I think stroke and cardiac have gotten a lot of the attention over the years. Some of the symptoms are a little easier to define. When you look at sepsis, often patients present with a little more vague symptoms. So sometimes those can be fever, weakness, rapid heart rate, rapid breathing, and changes in mental status or confusion. So they can be a little more vague, and just being aware of it alone is very helpful. So, it doesn't have clear-cut symptoms like a stroke or cardiac arrest, but it does have some pretty common symptoms, as I described.
You did list some of those symptoms. So when is it time to call the doctor?
If it's a big change from the normal symptoms, if you notice, a temperature over 100.5, if you're taking a temperature at home, if you notice they're breathing very rapidly, excessive sweating, shallow breathing, any kind of concern like that for a change from the ordinary, especially in our elderly population, it tends to affect more of the older population and the younger populations,
Well, the National Education Library of Medicine says education and training amongst sepsis is so far adequate. Why do you think that is?
Say that again. You said it was inadequate, or?
The survey says it's inadequate.
Right. Just because it's become more in the forefront recently, and so patients are basically become a little bit more aware with the recent COVID and so forth, but just being aware of those symptoms and seeking help at that point is important.
Anything else you want to add or people should know about sepsis?
Yeah, so early treatment is probably the best way to improve the mortality or risk of dying from it. So getting people in early, and then early treatment and recognition is very important. And so this is September, or Sepsis Awareness Month, and so I appreciate you guys putting it out there in the public, because it is a very long-term, it's been kind of an ignored topic,
Yeah, very important information to know. Dr. Ancheril, thank you so much. And remember, you can watch all of our health interviews right now on cbscolorado.com.